Breast augmentation patients tend to be either women who've never fully developed their own breast tissue or women who have lost breast tissue after having children. Breast augmentation is a wonderful technique to enhance the breasts. There are three major decisions that need to be made. The first is what type of breast implant we're going to use. The second is where we're going to position the implant relative to the muscle. And the third is what incision we're going to use. With respect to the implant, I use both silicone and saline implants. While they both have their pros and cons, I strongly feel that the silicone is more natural feeling. I think this is important for women that have very little of their own breast tissue. For women that may have some concerns regarding the silicone, I use saline implants. There are some advantages to saline, including the ability to fill more saline at the time of surgery to correct any asymmetries between the breast. With regard to positioning of the implants, I feel it is very important to place these implants underneath the muscle. In this way, you'll have more of your own tissue covering the implant, and there's less likely any incidence of rippling. Finally, I'd like to talk to you about the surgical approaches to breast augmentation. The three acceptable approaches include the armpit, underneath the nipple, and in the breast crease. While I perform all three techniques, I strongly feel that the most important component to achieving a natural result is making sure the placement of the implant is close enough and low enough. Next, I'd like you to listen to one of my patients who had breast augmentation and see how it had a positive change in her life.
My name is Kristen, and I've always wanted to have my breasts done, something that I have talked about since I was about 18. And I decided to wait until after I was done having children, and I have 3 beautiful children, and as soon as I lost the baby weight, I had it done. So I interviewed 5 different doctors within San Diego County, and Dr. Reagan was by far the one that I felt the most comfortable with. I felt like his office was the most professional. I felt like he was the most down to earth. It wasn't an awkward consultation. I had one that was a circus. I had several that I just didn't feel great with the doctor, but as soon as I met Dr. Reagan, I felt very comfortable with him. I felt like he answered all my questions. He had lots of information for me. We're looking at pictures, and because I felt so comfortable with him, I really did kind of let him decide what he thought was the appropriate size for me, and what the shape as far as, and whether or not I was doing silicone or saline. And I ended up doing the silicone. I'm really, really pleased with my results, and I've actually been able to refer several people to him just from my gym because they see me and they saw the before and after. So getting that feedback from other people is really, really rewarding. If you're thinking about breast augmentation with Dr. Reagan, I'm telling you right now, it's worth every penny, and you need to do it because it was one of the best decisions that I ever made. And it changed the way I feel about myself, it changed the way I carry myself, and I just feel like a more beautiful, sexy woman because of it.